Hello and welcome. I am Mara Cepeda. This is Rappler Talk. Today we are here with Dr. Jonas del Rosario, who is the spokesperson of the Philippine General Hospital, one of our COVID referral hospitals here in the Philippines. Hello, Doc. Welcome to Rappler.
Hello, Mara. Thank you for having me.
All right, let me dive right into my questions. A few days ago, the DOH said UP-PGH is the only hospital so far allowed to do convalescent plasma therapy to treat COVID-19 patients. And in fact, you have been asking survivors of the coronavirus to donate their blood so that it can be given to those who are still suffering from COVID-19. We understand it's a process where you transfer the antibodies of survivors to help boost the immune system of those who are still fighting COVID-19. What exactly happens to a COVID-19 patient who undergoes plasma therapy, Doc? And how have you encountered any significant breakthroughs in this therapy, in this treatment that is still being explored regarding COVID-19?
Thank you, Mara, for that question. As you know, convalescent plasma therapy has been around. It has been used in many pandemics caused by a respiratory virus. Unfortunately, COVID-19 is a new disease. So it is not yet scientifically accepted as a treatment of choice. Okay, but just the same, we take advantage of the historical fact that convalescent plasma can help. And so we are using it right now at the Philippine General Hospital under compassionate use, which means in a way it is experimental, and we only give it to patients who are severely or critically ill. So just like what you said, what happens is we harvest or we get the plasma of someone who has survived COVID-19 and fully recovered, no evidence of virus in the system already, and then that patient, the donor, has antibodies, and those antibodies are against the virus, specific for the nCoV, for the COVID-19. So we get the plasma, and then we transfuse it to someone who is just like what you said, afflicted and usually severely ill with COVID-19. Once we infuse it, what we expect or hoping to happen is over time, in the next 24 to even 72 or even longer, we should see clinical improvement in the patient. So we have many parameters to, to measure, to say if the patient is actually benefiting from the plasma that he or she got.
Okay. Ano po itong mga considerations that will indicate that your condition is already improving? If I'm a COVID-19 patient, how will I know if the plasma therapy is working? And kailangan po ba ng consent? I mean, if I have COVID-19, how do I tell my doctor in PGH I want to try this treatment? Do you offer it? Does it have to come from the patient?
No, we offer it. Yes, definitely informed consent is important. Okay. Now, there will be occasions when the patient is still strong enough to be able to express his or her desire to get plasma, convalescent plasma. However, in situations wherein they're already critically ill, almost at the brink of death, then sometimes we offer this therapy to the family, to the next of kin, and they're the ones who are responsible for giving consent. So either the patient or the relative will give consent. So we do that. Now, yeah, it is a known treatment. In fact, the one who usually will suggest the treatment will be the attending physician, because we have that option of giving this plasma. So they will usually tell the family, meron pong plasma na pwedeng makatulong, may antibodies po, baka gusto nyo subukan. And that's when we start like looking at our plasma bank, if we want to call it, and then we match the blood type of the donor and the recipient, and then now we have a criteria of whether that person has to be given or not. You mentioned about excuse me, you mentioned about what parameters do we look for. So we start with, most of the time, patients who have COVID-19, they're having respiratory distress, nahirapan
Mhm.
sila huminga, they're breathing faster, their oxygen level is getting lower and lower. So those things, once we give the plasma, we expect someone who is in respiratory distress or is lacking in oxygen, that there will be an improvement. Okay, so they will be breathing better. They will be requiring less and less oxygen.
Mhm.
There will be patients who are severely ill and they are in a ventilator. They're intubated, we call it. And if they receive the plasma, we would like to see them get extubated. The ventilator will be removed from their system and they will be breathing on their own, maybe a little bit of oxygen. Some will have markers of inflammation in their bloodstream. We do check their blood with several tests, basically telling us the degree of inflammation, because COVID-19 is a big inflammatory disease. And so we see that, we monitor that. For example, fever might be gone, maybe the x-ray will get better. So many, many things that we can observe, okay? And they they can be quite fast. It might be dramatic in the sense that in the next 24 to 48 hours, will already see improvement. But sometimes you have to be more patient because it might take longer, especially for those who are really severely or critically ill.
Mhm. You have been doing this plasma therapy trials in the past couple of weeks. Meron na po ba tayong mga COVID-19 patients na napagaling? And how do we assess it, Doc? I mean, how much percentage nung pagaling nila yung ma-attribute natin sa plasma therapy? Because no, right now, it's still, as you said, it's not yet considered a cure, but are things looking positive for plasma therapy to be a treatment for COVID-19?
We started our plasma therapy in PGH sometime in April, like the second week of April, after the araw ng kagitingan, no, when we had some donors. Okay, so far we have actually given we have 11 recipients, so 11 got plasma from our donor pool. There were already 19 donors. Out of the 11, six of those are actually hospitalized in PGH,
Uh-huh.
and five patients are actually hospitalized in another hospital. And we decided to give them plasma because at that time they do not have the program. So out of the 11 so far who received plasma, six are recovering,
Oh, wow.
which is, we're happy. We're batting like more than a little bit over 50%. And some are almost out of the ICU. Some have been removed from the ventilator. So positive response, very encouraging. Although I have to say that it is not only plasma that we're giving in these patients, just like what you said. How do we isolate the effect of the plasma? It's hard to say, but be that as it may, a lot of the patients are receiving the standard treatment for COVID-19, those antivirals, anti-malarials, some of the anti-inflammatory, and then plasma is one of those treatment towards the end, like a last resort thing,
Mhm.
which sometimes what we are concerned about is we might be giving it too late. But because right now our protocol is to use plasma for severely to critically ill, so because under compassionate use. But as we move forward, we will be looking into giving plasma earlier in the game,
Mhm.
which means those who are mild to moderately ill, we might consider giving plasma, and this will be under a research study. And what we are hoping is these patients, by getting plasma early, will be prevented from deterioration. So we will be pulling them out. They will not go into the ICU. We will sort of like arrest the disease progression, and hopefully you don't have to be critically ill. So that's what we're hoping.
Right now, Doc, the DOH is only authorizing PGH to conduct plasma therapy. Um, when do you think, sir, other hospitals will be given the go signal to actually do this treatment for their patients? And why do we have to be very careful? Siguro for someone who doesn't really understand the process of developing treatment, bakit po kailangan maging maingat?
I'm not, first of all, I have to correct you by saying actually, not only St. Luke's is, not only PGH is doing this,
Mm,
but almost simultaneously, the St. Luke's group
mm,
has been doing this also. I'm not so sure. I do, I agree with you. DOH issued a statement that PGH is the only hospital who
opo,
is
yes.
authorized to do plasma therapy. We submitted our protocol to FDA. And
Mm,
I'm not so sure if the other hospitals did, but certainly St. Luke's has been doing it. They have a big number of patients who have received it. There are also other centers which have expressed their desire to start convalescent plasma therapy. So
mm,
in due time, maybe just a few requirements here and there, and if they submit the right documents, then the DOH will acknowledge these hospitals also to be a convalescent plasma therapy center. So I don't want to say that we are the only one. We're not the only one. And I'm happy that other hospitals are also doing it. And hopefully we can share our own, we can share our experience, and then we will have more data. Because the more patients you treat, then your evidence will be stronger, right? That if it works, okay. So that's where now really you mentioned how hard is it to be able to have an approval of a certain treatment. It is very hard. You know, you have to really do clinical research, prove to the scientific community that your conclusion is based on strong evidence, and
mm,
you have to undergo clinical trials. Unfortunately, it will take a while. Clinical trials take a certain amount of time, and the reason is because you have to be very careful with treatment and non-treatment in the choosing of patients. So at least 1 to 2 years before the real conclusions will come up.
mm.
But at this time, we're giving it for compassionate use because we feel we cannot wait for those clinical trials. We have to give some of these patients plasma to be able to save their lives.
Okay. Now, Doc, how many confirmed cases are currently admitted at PGH? And kamusta po yung flow ng pagdating ng patients? Are you able to accommodate everybody? And I'm also curious about the process. What if I'm a patient who doesn't have COVID-19 but I either have an allergic reaction or meron akong stroke or I have a heart attack? Paano po yung process for me to still be able to be accommodated by PGH kahit meron tayong mga COVID-19 patients?
Okay, so the first question is how many confirmed COVID-19 patients do we have as of tonight? We have 118 confirmed cases, and then we have 4 probable and 10 suspects. Okay, so all in all, we have 132 COVID-19 patients. About close to 120 patients are already confirmed. Some are just waiting for their RT-PCR test, but
Mhm.
many of them, even without the test, they actually look and smell like COVID-19 because some of the other tests, like their X-rays, their history of exposure, their manifestations are all consistent with COVID-19. It's just a matter of confirming it with the RT-PCR test. Now, in terms of if you're a patient who needs to be seen, especially in an emergency situation at the Philippine General Hospital, we do have our own non-COVID-19 pathway. We have separated the hospital in such a way that those who have urgent or especially life-threatening or limb-threatening emergencies will be seen right away in our non-COVID-19 emergency room, and then will be admitted to the non-COVID part of the hospital.
Okay. Now, since you mentioned it already, Doc, can you run us through the process that the hospital management, had to go through and your staff had to go through to create your COVID-19 warrants? We understand it was very difficult initially. I mean, it was announced publicly, hindi pa handa yung facilities, and it's understandable. You have other patients to take care of. And what were the essential equipment? essential, number of beds, number of ventilators, that you had to secure, you had to have in your COVID-19 ward, to make sure that the patients are not the only ones protected, but even the doctors, the nurses, and all the medical professionals who will be entering are protected from the disease.
Yeah, Philippine General Hospital, as you know, is the biggest government tertiary hospital, at least in Metro Manila or in Luzon. And we cater to so many patients with different problems. And so when we eventually responded positively to the call of the government for us to be a COVID-19 referral, it was not easy. It was we need to explain to, first of all, to our consultants, to our doctors, the repercussion, what will happen to our patients who are non-COVID-19. Some were saying maybe it's better off for the other hospitals, the DOH hospitals, to accept to be the COVID-19 referral centers, and we will take their patients who are non-COVID. We'll take care of the rest. But
Mm-hmm.
obviously, that did not happen because we were saying, look, the call is for us to be a COVID-19 referral center. So, simply put, we decided to which part of how much of the hospital will we allocate for COVID-19? How many beds are we willing to give up to take care, to cater to this COVID-19? So we eventually decided with the number 130 beds, and 130 beds would require four big wards in the charity wing of the hospital, wards 1, 2, 3, 4, and each ward has about 22 beds, so that's about 88. And then we have to open also the Pay Hospital. We open two floors of the Pay Hospital because we were sure that we will be accepting some private patients as well, especially the private hospitals, especially the big ones. One by one were already calling for help, and they basically have closed their doors to the COVID-19 patients that they're sort of like overwhelmed already. So we did that. Now the next question is, okay, so now you have the bed allotment. How are you going to divide the health force? So what we did was we decided to create. First of all, we needed to reduce the workforce to about
Mm-hmm.
one third. Like not everybody has to be there every day. So we decided to make a team of three. So there will be three teams, teams A, B, and C, and each team will go on a 1 week straight duty
Okay.
and
Mm-hmm.
then 2 weeks off. So it's a 1 week on, 2 weeks off kind of rotation,
Okay.
which means you allow the workforce, the healthcare workers, doctors, nurses, paramedics, to get some kind of respite, 2 week quarantine in a way, because they got exposed massively in their 1 week tour of duty. So we did that also. So we also have to. We decided that about 900 healthcare workers will be part of the COVID
Mm-hmm.
area, and about the rest will be still covering for the non-COVID. The third is we have to get the right equipment, okay? Because obviously we have to create a sort of like creating another hospital within a hospital, and you don't really want the mixing of patients. You don't want them to interact with the non-COVID, so we have to basically divide the hospital. So we asked for equipment. The ventilators, we only have probably about 20, so we eventually increase it to 60 for the COVID, and then we got donations for beds. We look at the oxygen supply, the electrical wiring, and a lot of things. There's a list of equipment that we needed. We got it from the government. We got it from our own funds. We got it from many donors, and we're very happy. In fact, for one thing, one good thing that happened because of this pandemic is PGH became very equipped. Like we were
Wow,
like
that's good.
we're like equipped almost like a big private hospital, because we gave what the doctors were asking. Like, let's say, okay, we need to have this and this and this because, by let's say, an example is an equipment wherein if you want to intubate someone,
Mm-hmm.
you cannot be very close to that person's oral cavity. So there's now a certain type of equipment wherein you can see the airway, but you're far from the patient because there's a monitor. And then some of the doctors want specific masks, so to protect them and all of those. So fourth, of course, is to make sure that our workers will have personal protective equipment. So we made a run for that. We made an appeal. We got it. And that is one way of securing, making sure our health workers will not be exposed unduly because of lacking in PPEs. Okay, so we have enough of those. And I'm proud to say that I think we're only one of the few government hospitals which can boast that we have a good 1 to 2 months supply of PPEs for our health workers. They don't have to worry about it. We worry about that. Their worry has to be the patients. We take care of their needs. So that's pretty much what happened. And of course, we had to create a COVID crisis management team. We didn't have to bring everybody. The director pick his men and women who will be sort of like really the think tank, will be there day in and day out, sort of like fixing. So we were able to do that, and we asked a 1 week allowance to prepare for all of those, including making sure the rooms are fine and all of those. And now we seem to be operating quite well. We are now in cruise control, I would say. After about 4 weeks, we learned a lot of things from other hospitals. They gave their best practices, which we absorb and we try to adopt. So more or less, we're good. The challenge now eventually is transitioning, reopening a part of the hospital now to the non-COVID. You see, what happened was we suspended or stopped our elective admissions, which means if the case is not an emergency, if it's non-COVID, then that will not be done. But eventually, you do know that we have patients who are urgent, semi-urgent, who are waiting in the wings for the PGH to finally, again, open its doors to these patients. And so slowly, we have to transition that, and that will be a different team. It's still enhanced community quarantine, so people do not really want to go to the hospital. But you could just imagine, once that is lifted, those patients who have been waiting for a long time, for example, those who have heart diseases, they need some type of a heart procedure, someone who is on dialysis and needs a more frequent dialysis treatment, these are patients that we need to again bring back to our system.
And Doc, we know that medical professionals, as you said, are among the most vulnerable to COVID-19. And we're seeing that, for example, at the RITM and the National Center for Mental Health, the medical professionals are the ones who are actually, getting COVID-19. What are the things that you had to do? Apart from ensuring giving them enough PPEs, giving them enough surgical masks every time they go on duty, to make sure that they are protected. If I'm a doctor and I'm going to be assigned to the COVID-19 ward, what's the process I have to go through before I'm able to enter? And then when I go out, meron tayong tamang pagtanggal din, Doc, diba? Ng proper PPE. Can you run us through that process?
Okay. So, yeah, you're right. First is making sure that we have the right PPEs, so that has been taken care of. The second is to make sure teaching our healthcare workers not to contaminate themselves. Okay, so the proper donning and doffing of the PPE. So there is a training before they go on the tour of duty. So we had these seminars. That was part of the 1 week reprieve that part of the planning at that time. Then, just to make sure that they do not forget anything, we have what we call a safety officer. So while they are putting on their PPEs, they have a buddy, a doctor or a nurse, mostly the doctors who are teaching them the proper way of donning. And some of them will even be taping loose ends, making sure their masks fit well, that the gloves are on, so they have to tape it on. So there's a safety officer. And it makes things easier because now you're confident that just in case you forgot a step, there's someone who's going to correct you. Okay. So now, when they enter the COVID-19 wards, they're properly wearing the PPE, what type of level, and they're all like the way that it's supposed to be. They know what they need to be doing. Cell phones are not allowed inside. There's a certain infection control measure that you have to do. Avoid touching the mask and all of those things. Okay. Now, the once your tour of duty is finished, the more important or worrisome is what we call the doffing. Because now you have been exposed to the COVID-19 patients, you carry with you the virus on your suit, on your goggles, on your mask, so on your gloves. So there is again a safety officer who will be guiding you one at a time, not in a hurry. Just take your time, making sure you're doing it the right way. So in that case, everybody feels so relaxed because they know there's someone who's going to tell them, okay, now it's time to remove, let's say, your goggles or this. And so it's so nice to see it because apparently that is one of the reasons why some of the health workers get infected, because sometimes no one is teaching them, they forgot, even if it's listed there, right? So, but we didn't want to take any chances. There's always a safety officer there. Okay, so the second is we are very strict in physical distancing. Okay, sometimes we have noticed that when their tour of duty is finished, you know the feeling of being there for 8 hours and you're so tired and you just want to talk to someone, maybe sort of like, and so there's a tendency to congregate. There's someone who's going to tell them you have to maintain physical distancing.
Ah.
There was a time when we have long tables and they will eat. We noticed that because there was a long bench, we noticed that their physical distancing gets shorter and shorter because they tend to get together. They want to chit chat. So eventually, we remove the long table. We put those classroom chairs wherein there's a desk. You're by yourself. You're eating. Okay, so very important physical distancing. And then we are very particular of our healthcare workers, trying to ask them if they have symptoms, fever, cough, colds, because the moment they become symptomatic, of course, they have to be tested and they have to be isolated and quarantined. So those things. Out of the 900 healthcare workers in the COVID area, we only have 41 right now, 41 healthcare workers who got infected. And
Oh, that's quite.
when we analyze, only about 15 really were in the COVID-19 ward. So the others got their infection somewhere in their communities. Okay, so maybe they went somewhere, they got exposed. But so 15 out of 900 is quite low, no?
Yes, it is.
Uh, so it's almost just maybe 2% or not even, right? So we're very happy with that because it's a big problem if your health workers start really getting sick. It actually not only physically, but it creates a chilling effect to a lot of people. They become like concerned. Oh my God, I probably will be the next one to get infected. And so we try as much as possible to make sure that they are protected and they will not get contaminated by the virus.
Doc, what's the status now of these 15 confirmed cases among your staff? Are they well? Have they recovered? Are they still
Nobody has died, thank God,
okay? Thank
right
God.
off the bat. So 41, even if they got it from someplace else, it's still 41 healthcare workers out of the 900. Some of them are mild COVIDs. They are in the hospital. No one is in the ICU. No one is intubated. So more or less, they are manageable, and I think all of them will make it. Okay, we do have one doctor who died at the Philippine General Hospital. He is one of our consultants, although he got it from another hospital. There was a COVID-19 patient he got exposed to, but then he eventually ended up being admitted to PGH. So that one didn't really get the COVID-19 in PGH, but just the same, it's still one of us.
Doc, you mentioned earlier about the chilling effect, if regarding COVID-19. And one thing that, we've been observing in the past weeks is that, not only is the disease very scary, especially for someone like me, you didn't go to medical school. So my understanding really just comes from what I learned from experts like you, but it is also isolating. Isolating in the sense that, right now we're in quarantine. But, for doctors, for everyone in the medical field, kami po mga ordinaryong tao, we always expect you to have the answers. But sometimes you tend to forget that you are also people dealing with this pandemic. And like you said, kahit yung simpleng pagkain after ng duty, hindi na pwedeng gawin, di ba?
Yeah.
So how do you take care of the mental health of the staff in PGH? What kind of support system do you provide them so that they're not only physically well, but also mentally fit, psychologically ready to face their patients every day?
You're right. Everybody just have to remember each health worker is a son, a daughter, a mother, a father, a brother, an uncle, name it. So you always think of what's going to happen to me in relation to my family. You're right. Well, a lot of our health workers actually would choose not to go home in their
Mm-hmm.
communities. I told you it's a 1 week on, then 2 weeks off. So some of them can actually go back to their families. Many choose to stay in the housing or the lodgings that we provide, on the accommodations that they have, simply because they're worried that they might expose especially someone who has some, let's say you have a parent who is diabetic, who's an elderly, or you have some kids, you're worried that you might infect them. So now the isolation, just like what you said, is real. So what we do is we do have a counseling session. Every now and then we ask the nurse supervisors, the head of the units, to talk to them, get sort of like a debriefing. Are you okay? We try to make the lines of communication between the administration and the health workers really very fluid, and that they can always come to us their concerns. So we do that. So in a way, we have some mental or psychiatric support that we do.
That's
We
good.
we give them we give them encouragement. We recognize their sacrifices. So every tour of duty, after a week of tour of duty, they will hear something from the director, sort of like thanking them. We give them some perks. We support them in a way like they don't have to worry about their transportation. We provided the shuttle buses for them. We take care of their meals. We take care of their housing. So those little things, we don't want them to be worrying anymore. We don't want them to be walking along the streets of Manila, being discriminated, and so we have to make sure that the transportation is there. So overall, I think we are doing that. We need to talk to these people. Just today, I saw some nurses, and I asked them point blank, what are their concerns. How do they feel like they're protected? They said their PPEs are okay. It's still the mental or psychological worry that what if I get the disease? Okay, and sometimes you see them when they answer, they get teary eyed because it's real. You know that everybody knows that it is a duty. It's your
Mhm.
responsibility. Every time we go there, we pray. We try to help each other, praying for everybody that nobody will be suffering and dying from this COVID-19. That's a big, I mean, as the administration, we have sent them to battle. It's like a general, the director, it's like a general sending his troops to the battle, and some of them probably will get COVID-19, and that's a big concern because you don't really want them to be suffering from this because of our decision. And so at least we arm them with the right PPE. We nourish them. We provide for them. And then, of course, if they need to be supported mentally, we're always there.
Ikaw, Doc, how are you? How have you been dealing with this COVID-19 crisis? Do you still get to see your family?
I do well. I'm not doing the 8 hour shifts. I'm the spokesperson of PGH, so almost every day I should be there. I have
Mhm.
to know what's going on. But I also have my practice. I'm a pediatric cardiologist, and every now and then I have to see a patient. Sometimes COVID-19 suspects. I have to don the PPE. I tried it a couple of weeks ago. I have to see a 14-year-old girl with COVID-19, and I have to evaluate her. She has a heart problem, and I was wearing it for almost just an hour, and I was really having a headache. And I was just imagining, oh my God, how about the people who are really wearing it for 8 hours? Okay, I do worry sometimes for my family. As you know, some people will be telling me, please, please don't get exposed, don't get sick. We need you. All of those things. You know, we have patients, we have families. But just like anybody in the medical field, when you're called, that's not an excuse. Okay,
Mhm.
so lots of prayers, and then making sure that we know how to protect ourselves.
Okay. Doc, winding down to my last few questions. In the past couple of months, much has been said about how the government has been responding to this pandemic. As Doc, as a frontliner, as a spokesperson of one of the leading government hospitals in the country, do you feel the support of the national government to medical institutions like PGH? Is there a part of you that feels the health sector has been neglected or hindi po nabibigyan agad ng tamang atensyon dito po sa cases na ito?
With regards to PGH, in terms of support, we get support from DOH. When we agreed to be part of this referral system, one of the conditions we set is you have to support us. You have to equip us. Please send us equipment. Please send us some volunteers, healthcare workers, support us. Do not just dump it on us. And so far, they have been fulfilling their promise. We get their support. We are in good communication. We support each other. We realize that when the government asks for our help, I mean, PGH is sort of like regarded as one of the leading institutions. And so I think when we responded, it sort of like snowballed and other institutions followed. Okay,
Mm.
and so that's a good thing. I think the first few weeks probably because it was really we were not prepared. Everybody's not prepared. Even the big medical centers were not prepared.
Mm.
We had some time to prepare. The DOH initially was sort of like scrambling, I think, but then now they got their acts together, and then they were able to ask the help of other agencies, treating it like a disaster. And so
Mm.
there are more agencies involved. And the testing now is capacity is increasing. We have quarantine centers now to help and accommodate these patients. So I think we are on the right direction. Coupled with this, the extended or the enhanced community quarantine, it has flattened the curve. It has helped the healthcare system to not get overwhelmed. That's one thing. We need some time. And so I think we are ready, and we're doing okay right now. So overall, I think that the government support is there. The president has said that funds have been poured down not only to the healthcare system but to our those less fortunate people who have lost their jobs or. So I think we are in the right direction, and there is one good thing. You can also see the bayanihan spirit, not only the government, but you can see the overwhelming support that PGH got. Oh my God, we realize so many people actually do care for PGH, and we got so many donations. The private sector has played a part in also helping the country solve this crisis.
There's going to be a new normal once the lockdown is lifted. Paulit-ulit na po itong
Yeah.
sinasabi.
I,
But what does that mean for the Philippine healthcare system? Or, if you want to be more specific, what do you think this is going to mean for PGH? Moving forward, what are the implications of this new normal in terms of how people are going to go to the hospital, paano na yung magiging experience namin sa
yeah.
hospital, and how the management will have to run the hospital from now on.
Yeah, the new normal is still a big unknown in a way, but clearly it's going to be different. Like people now will be more careful. Healthcare facilities will institute measures to prevent transmission of the disease. For an example, now there are talks of how will be a clinic visit be? When before, I'm a pediatric cardiologist, I'm used to like even hugging my patients before, because these are kids. So we play around, we do high fives, so, and then I auscultate their chest. I listen to their lungs. I examine and feel, palpate. These are things that doctors do. Now you're like, okay, why don't we first have this telemedicine engagement? We're in, we're seeing each other, okay? So gone are the days wherein you can be very close. Now the clinics, the hospitals now will implement physical distancing. So appointments cannot be just haphazardly be done, or somebody cannot just walk into the clinic and expect to be seen. Usually it's going to be an appointment. And okay, so, and I'm sure the doctors or the clinics will limit their patients because they cannot allow like 20 or 30 people in one area. So it's going to be, okay, this will be your time, and it's going to be this physical distancing. The way that we're dealing our patients now, anybody who has fever will be treated as someone who might have COVID. And so they go to a different route. Everybody is like suspicious of someone who's coughing, someone who has a sore throat, okay? And I can see in the communities, just imagine, do you think we will still be able to watch movies all together? Do you think we will have concerts which are jam-packed? Do you think we will have a situation wherein you can just hug people? And I wonder what's going to happen. It's going to be something that we really have to think about, because COVID-19, unfortunately, there's still a lot of things we haven't understood in this disease. We don't really know how long it will last. It might take, some people say it might take a year or so before it's gone, even though it has slowed down. But every now and then you will probably have some surge of COVID-19. And so then people will start like becoming more careful again. So, but definitely, I'm sure everybody now is conscious that you have to wash your hands for 20 seconds. Everybody has to wear a mask. There will be a lot of Zoom meetings, a lot of this. Maybe we'll be watching Netflix more often than going to the movies. So it's gonna be something. I don't know what's gonna happen to the traffic in EDSA. I don't know if it's gonna be back. I hope not. But yeah, the new normal is really something different, something that we are not used of. In fact, something un-Filipino, because we know we are a very social group. We like gatherings. We like being together. We like hearing mass. We like, it's something that it's gonna be hard. It's gonna be hard, and but of course, right now the more important thing to do is to protect ourselves from getting COVID-19, and I think people will be careful.
For my last question, Doc, medical professionals, all frontliners actually, have repeatedly been called as heroes, bayani, ngayong may COVID-19. But, beyond receiving praises like this, what support do you need, not just from the government, but from your fellow Filipinos moving forward, and moving on from this pandemic, hopefully? What is your message to the Filipino people?
I don't think the healthcare workers, we're glad that we're being called heroes at this time, but I think we're not really after being put on a pedestal. I think more than anything else is we want people to cooperate by following the rules, because it's a way, in a way, it's a non-medical way of helping the frontliners. Because if you don't get sick, then we don't get bombarded with patients. We don't get overwhelmed. So that's one. Please stay at home or follow whatever's going to happen to avoid transmission. But second is to, I hope you can, if you cannot really praise the health workers or put them in a pedestal, please support them in a way that don't discriminate them. Don't make them feel like they're bringing something, like they're the transmitter of the disease. They're not vectors. They're actually the ones sort of like putting their lives on the line to be able to keep you safe. So those things. And just like what we say in UP, it's really a time for helping each other. We call it bayanihan na. So I think we can beat COVID-19 if we, as a nation, will really unite and lift each other up.
Mhm. Thank you so much, Doc Del Rosario. Very well said. And you've really given us a glimpse on how PGH has been helping COVID-19 patients recover. And mukhang okay naman po yung ospital niyo, Doc. So congratulations po. Sana po lahat po ng pasyente natin ay gumaling.
Gumaling. Maraming salamat po. I'd like to take this opportunity. Lahat po ng tumutulong at tumulong sa PGH, sa lahat po ng mga nagmamahal, nagpapalakas po sa loob namin. Maraming salamat po. We heal as one.
Now, you have just listened to UPPGH spokesperson Dr. Jonas del Rosario, who talked to us about plasma therapy and all the adjustments they have had to make in the hospital to make sure that all the COVID-19 patients are well taken care of, and also all medical professionals in the hospital are not going to be exposed to the disease. Once again, this is Rappler Talk. I am Mara Cepeda. Join us again next time.